which is I see prior authorization. If I boiled it down, there are really two things about it. One is, do I have the right data? Meaning that I filled out all the forms correctly, for lack of better terms. And the second part is, does that data, does the information that I provided actually meet the requirement, the minimum requirement associated with the procedure? How do you guys manage that? How do you tackle something that's so subjective?
Yeah, this is one of the biggest challenges in healthcare today, is really figuring out how to interpret and how to then turn these complex rules that need somebody to interpret them into something that actually can be done by a computer. And so there's a combination of things that we do. UiPath is a part of our ecosystem here at Mindshift, as well as other homegrown technologies that we've built. The main three things that we're doing, though, to build this into a streamlined and automated approach to authorization. The first one is aggregating and managing all of those policies. And so we have natural language processing models that we're doing using UiPath to identify guidelines and identify changes in guidelines on published websites. We're looking at claims data. We're looking at published feeds of data from payers, and pulling all of this information into a platform that we've built that brings all of this data into really a complex rules set that we can actually identify what is requiring auth and ultimately what is likely to be approved and denied, and then ultimately adjudicate that authorization for payers. And so we expose that through a set of 807 FHIR APIs. And so we have those APIs that are available to be integrated into clinical systems, EMRs, whatever patient management system is being used. We have a portal as well that's available, and we have quite a few providers that take advantage of that. But one of the things that we really have recently launched that we're really proud of is custom activities in the UiPath marketplace for all of these different parts of the process as well. And so because we have these APIs, you're actually able to now drag and drop things like checking for specific eligibility information for patients, identifying if an authorization is required or not required, submitting prior authorizations, identifying what the likelihood of being approved or denied for an authorization is, all right inside of UiPath, literally drag and drop out of the marketplace in a custom activity. And that's really an exciting thing for us to launch that.
What would you recommend to the audience on how to get started with any intelligent automation solution, especially with document understanding?
Sure. I would say certain best practices, right, that have to be kept in mind when it comes to an IDP kind of a solution. Variability analysis, right, that is first and foremost, I would say. There can be a variety of data that exists in your enterprise for a particular use case. So ensure, right, your ML models are trained to handle all these various possibilities around the known patterns from a real world production setting. And this need not be, in your first MVP. Your MVP one can focus on your top categories or top templates, which drive the most volume. Another best practice is, right, don't consider IDP or a deep learning as a replacement of an employee. I always think it's more like a bionic arm than a robot. So the solution needs to be more human centered and should always be thought of as an extension of an employee. One more best practice, right, would be data labeling, right? That is the critical step. The ML model outcomes reflects the data they are trained on. So it's essential you analyze your raw data very carefully to understand it, perfect it, correct for missing or incorrect values. And I strongly encourage business SMEs or someone who knows that data well to be involved in that process rather than, leaving it for an IT team to handle it.